So this section is, you can find in the workbook, the yellow workbook, chapters 3, 4, and 5. So let's start thinking about ways to reach our communities and our different community members. The strategies in this lesson encompass 3 overarching activities: getting to know your audience, number 2, taking action to spread safe sleep messages in the community, and then 3, planning and sustaining a Healthy Native Babies project here in your own community or with the people that you work with. Who needs SIDS education? I think we've been really clear as we've been working together today that it's everybody that needs SIDS risk reduction education. So everyone who cares for infants or cares about babies needs SIDS education. So parents and parents-to-be certainly are a key group that we want to reach. Also include foster parents, because we know a lot of families, a lot of babies are living in foster situations, often with relatives, and so they need SIDS risk reduction education. And then everybody in the community, elders, as we demonstrated in the scenarios, elders are a real resource for communities, for families, and so they need the right information to be able to share with the families and everybody that they come in contact with. Youth are also an important group that we need to reach. Often youth are taking care of younger siblings or babysitting, so they need to know the ways to reduce the risk of SIDS. And then other families and friends. So many people are working really hard and will leave their children with trusted friends or other adults, and they watch the babies. So anybody who takes care of a baby needs to have SIDS risk reduction education. Child care providers are also an important group that need to have SIDS risk reduction education. Here in Washington State, there's been some babies that are dying in child care places. And so there's been a lot of attention at the legislature on, there was a roundtable that was convened a couple months ago specifically addressing SIDS and child care providers. And so there is definitely a need to educate those folks, so home daycares and then other licensed daycares as well. Everybody needs SIDS risk reduction education.
Well, and one of the things that I find stunning is that 20% of the infants who die of SIDS are in the care of somebody other than the parent. And so often that means in a child care situation. I mean, that's 1/5, right, of all the SIDS babies. That's a stunning statistic to me.
Mm-hmm. And we talked about this too. Healthcare providers also need SIDS risk reduction education. We were talking about doctors and nurses who weren't necessarily giving good information to families, and so having a connection to providers is also really important to share this information with them. So doctors and dentists, nurses, pharmacists, and public health educators, as well as emergency responders and first responders who are coming and having to come into some really intense situations. They also could benefit from SIDS risk reduction education. And then again, all community members, everybody should have this information. Everybody who takes care of babies should have this information.
So good relationships, that's something that we were talking about. Did you plant that purposely to give that to me? Something we were talking about in terms of how important it is that when we build those good relationships, that we're most likely to get into people's minds and hearts. So be consistent. It's really important to be consistent with the message. And I think we were talking about that in that one group that you were in. Same information, same messages, and same images and methods. So it's not good for us to give this group this information and then this group this information, because it's so confusing. Because as Maria and I were talking about earlier, when we were raising our babies, everything was different. All the information is different. So it's really important for those of us who are trying to re-educate the entire culture, really, that we be good information and messages, but same images, same methods. Be really consistent. And why is it important? Because if we, for example, help parents understand the importance and their families understand the importance of back sleeping, but then they take the infant to a child care center that doesn't have that kind of a protocol, and they sleep the baby on the stomach, those babies are 8 times higher risk for SIDS. Babies who've already been back sleeping and then are switched to belly sleeping. Isn't that an amazing statistic? Be effective. So one of the things that these stations were really, really good for, and especially I think this one here, where you're trying to teach people about that safe environment, is that guilt, fear, shame, all of those things are the wrong way to go at it. If we try to undermine a parent or a caregiver's innate love for and innate smarts and wisdom and knowledge, they're going to shut us off. So it's important to use really good techniques when teaching, and to give praise and to congratulate people, and to just continue to let people know we understand that you as the mother, father, caregiver, consider this baby the most important thing. You know, that we know you're smart. We know you want the best for your baby. So always give the kinds of things that will open people's ears to hearing the parts of the messages. You got to make people feel good before they hear the message, right? You don't make them feel good, they're not going to hear your message. They're going to turn you off. So let's talk about some special audiences, some hard to reach groups. Remember, there's hidden groups all over our communities. Go to where they are, because sometimes they might not be able to come to where you are for a variety of reasons. Go to classes, health fairs, gatherings, and collaborate with the community outreach. What's really nice about this meeting and these kinds of sessions that we teach is that there are those of you from other groups, and you can cross-pollinate and cross-train with one another. So, you know, this group might already know some things that this group would find helpful about going to probably hard to reach groups, you know, for sure. So talk to one another. So here are some of the special audiences: the homeless, the incarcerated, those using alcohol or substances, families affected by mental health problems, and families that are FASD, FAS, and FAE, So these are the special audiences that really need our attention. So when reaching out, be persistent. Continue to go where the people are. It doesn't do us any good to have all this great information and all these wonderful brochures if they're sitting in the office somewhere and the people who are on the streets or incarcerated or don't have transportation don't ever see them. So go out to where the people are.